Hi, it's Dr. Janet Pope. I'm a roving room reporter at EULAR 2023 in beautiful Milan, Italy. I can be followed at Janet Burdo, and I'm reporting on EULAR today to talk about difficult to treat rheumatoid arthritis, or DTT. And I'm going to talk about this study, which was an oral presentation, OP0117. So a large database was used to look at refractory patients. And refractory patients already have a definition of difficult to treat. They've cycled through many drugs. They might have high disease activity. Maybe they didn't tolerate drugs, etc. So a chart audit, very large, was done. And what they looked at was two kinds of patients. Maybe there's even more, and I'm going to give you a third kind. So they looked at patients who were refractory or difficult to treat, who had high disease activity, and patients who would meet the definition of difficult to treat RA, but they actually had low disease activity. And as you might suspect, they probably had a lot of chronic pain. So the patients were different in the two groups. So as you might suspect, refractory high disease activity patients were high in disease activity. They had more inflammation. They had actually lower BMI than the group that were non-inflammatory. They had high CRP. They had a high swollen joint count, and they had, by definition, a high disease activity. And conversely, the other opposites were found in the refractory patients who had low disease activity. I think, though, there's a whole nother group of people. I would call them difficult to treat and refractory with their RA because they have multiple drug intolerances, or maybe they're non-adherent or really intolerant to drug after drug or cycle quickly. And this group is probably partly in each of the two groups, I would suspect. So my bugaboo right now is that I think difficult to treat RA should be hyphen low disease activity, hyphen high disease activity, hyphen intolerant, and then we would know what we were studying, because putting these patients together is important because they all have cycled through many drugs. But I think it's important this time to split them into groups so that we know how to have strategies to help better adherence to treatment or better improvement by changing their pain meds, and also more improvement if they had high disease activity by changing their advanced therapies or whatever they're on. So I think we should all think about this. So please follow us at Room Now. And if you think difficult to treat RA should have a better definition, please let us know. Thank you.